Hey everybody, welcome and welcome back. I'm Tracy, and today we are going to talk to LaFollette Veterinary Clinic and the owner and vet and technicians here to give you a little bit more information about what services they offer and what they have going on here at the vet in LaFollette. So Kristy, Templin,
Yes.
owner of the vet clinic. Tell us a little bit about the history of the clinic and how you ended up here as the owner and how you got here in 2023. A little history.
Well, I appreciate the opportunity for you doing this. This clinic was built in 1976.
Wow.
I started in 1997 after I graduated from LMU working for Dr. Bill Sanders, and this is all I've ever done. I worked here for him until he sold it in 2020, and that's when I bought it.
Right in the middle of a pandemic.
Right.
Could have been better timing.
Right. It's a very well-established clinic, and I mean, this is all I'd done. I'd managed it for him for years, so I had a good idea of what's going on and everything. And
It made sense.
yeah, and this is all I know. This is all I've ever done. So, and I love animals. So,
what a great opportunity. So I was talking a little bit before we started about some areas, I know like in Metro Atlanta and different places, corporations and big companies are buying clinics. Are we seeing that in Tennessee too?
we are. You see that in like the PetSmarts, the Banfields, and BACs and stuff like that. And it is. They come in and try to buy out small clinics. I like the established, hometown veterinarian where you're established with your clients. You know them by name. You know they're not just a number.
Right. And if, like with me,
their pets.
If I bring in a rescue from somewhere, I'm going to take care of it and what I'm going to expect and want. You don't have to wonder.
Right. We have that bond with our clients.
Yeah.
And I think that means a lot to us and to them.
Well, it certainly has to me when I've lost a lot of dogs lately. Not through anything that I've done at this old age. And coming in here, the comfort of knowing that I'm with friends when they do pass.
Right, and you've rescued a lot.
I have, and it's hopefully we'll get right back into that, and I can get back to it. I'm taking a little break. My heart had to take a break. And you can only do that so much,
You get very attached, and you've done well with it.
You all get attached to the dogs too.
Oh, we do, yeah.
I remember that when I had one in here, that I kept saying, I think she's still alive. I think she's still alive. And you're like, she's actively dying. No, she's not alive. But you could see that I was in such denial. It was Mimi. And I was in such denial. And you were looking at me like, this isn't usually the way you act. But it's, me. And, you could really help me through those tough times. And you can't put a price on that. And you certainly can't find that everywhere.
No, you don't. And that's what we're here for. I think that's part of our job. And that's what we should do.
Yeah, it really does make a difference. Is there anything that you think, besides the people here, the patients, the dogs, the customers, the humans, the staff here, that makes LaFollette Veterinary Service special? Is it just the relationships, or?
It is. We have a great staff, probably one of the best that we've ever had. They all do a wonderful job. They're great with our clients, and having that client communication basis is good. I mean, they call in, you'll know them by name on the phone and everything. And I think that means a lot to the clients.
Even though you're so hometown and so, personal focused, I still love that I get the text like, hey, Luna needs a vaccine. You have some sort of an automated system, which helps me because I may not, especially when I had, at the time I had 5 dogs, I may not remember who's due for what. So when you've added that.
Right, yeah, we get the text message for reminders on blood work, vaccines, all that stuff. And the latest thing, we've added an online pharmacy. So you can just call, get online with us and it comes, through us. And then they ship it right to you, but it's connected all through us.
Oh, wow.
Kind of like the Chewy, stuff like that, but kind of getting Chewy out of the picture
and doing it just personal with your vet.
Yes.
I love that. Well, I love that you all have the technology and all the fancy stuff, but then you still have the personal touch and the connection with your patients.
Right. And we try to offer all we can. That's our job, to offer everything we don't. Everybody doesn't want to do everything, but we offer, what we recommend, and then that's totally their choice.
Yeah. Well, we sure do appreciate y'all being here. And for the people on the lake, it's just good to put a face with a business.
It is, yeah, and I appreciate you doing this. And we see a lot of lake people in the summer. You know, their pets unexpectedly come down, get hurt on the lake, something like that. Or they forgot their medicine. Traveling, they forgot their medicine. Dog has to have the medicine. We see a lot of different things that you wouldn't think about.
Right. Right. And especially for folks that have a second home here, it's good to bring them in and get them established as a patient here. And then even you could have two. A lot of folks split their time. When they're bringing their dog, it's really smart to have a relationship.
Right. And we can correlate with their vet in the other state or anything like that. You know, it works out well.
Good.
So,
all right. Well, thank you so much.
All right. Thank you.
Now we've got Dr. Tatum Marquis, and we have Kristin Miller with the LaFollette Vet Clinic and Veterinary Clinic. I never say it all the right way. But we can get a little bit more information about services that they offer and how things work here at the clinic. So you're new, you're old.
Been here a while.
Yeah, I think Kristy said that you used to come in and volunteer when you were a kid. You've always liked animals. Always been an animal and a track star, but always been an animal person.
I started coming in middle school.
Really?
From the time the doors open till they close, she'd let me come and help.
Well, now, are you a cat person or a dog person or a...
I like them both, but probably more of a cat.
More of a cat. Okay. So, and I don't know anything about animal husbandry or anything else, so you're going to have to tell me everything. So when you're looking at, we just went through a lot of stuff with renal failure with my little poodle that passed away. When you're looking at labs and at x-rays, I mean, obviously it's an animal, but is there a huge difference, like in liver function, kidney function with a cat as opposed to a dog? Is that...
Yeah, each species has their own tendencies of getting different disease processes and how they respond to medical management, things like that. There's different prognostic indicators on blood work as well. So we really interpret our lab work based on the species a lot of the time, and what values are high and how do we manage that. And that's one thing I like about this hospital is we can run that blood work here. It takes 20 minutes. And you're
not sending it off or waiting. So you have a lab here. You have x-ray. I know you've got the thing where you can look in their ears and then you can see it on the screen. And what I love is when we do have an x-ray, in the past you come in, show me on the x-ray, okay, here's the mass or here's the blockage or... We have such a history. I'm a frequent flyer, but I can see it right here instead of you trying to...
Explain
it to me. So you have lab, you have x-ray, you do surgery.
We have ultrasound too.
You have ultrasound, okay.
We have dental scaling capabilities as well. So we just got a brand new machine. It's very high tech. It's very nice. It makes things go very smoothly, so that we can facilitate those extractions and cleanings on teeth that need to be worked on.
And we look at a lot of cytologies too.
Yep. Okay. So if you have an ear infection, skin infection, or a mass that we can poke with a needle, we can look at those things microscopically, see what kind of organisms are there, whether it's fungal or bacterial in nature, or what type of mass it may look like. It's an early test that we can kind of screen the masses for. And it can give us an idea of if we need to go to surgery in the future sooner rather than later. I'm not by any means a pathologist, but I can look at things and know if it's looking abnormal or dangerous or anything like that.
Or if it's a fatty tumor that we're not going to worry about.
Exactly. Yeah.
That's what you like to hear. That one.
Yeah, that's a good one.
That's a good one. So, Kristin, you guys have added crematorium, and I know we mentioned just a minute ago, sometimes folks are traveling or they have a second home here and their dog passes. So that's something good. I mean, it's nothing you really ever want to have to use, but it's something good to know.
It is, because they get down here, they're going to be here for a week, and they don't know what to do with their pet. They have no other options right now. So we've done a few, and we get it back to them quick before they do have to leave.
So that they can just transport it back home.
Yeah.
That is just something you never think about. You bring your dog to the lake, you don't think about something happening, an accident, or even people with second homes, like we mentioned a minute ago with Kristy. I do sell a lot of real estate on Norris Lake, and people most of the time have dogs. Mm-hmm. And when they come, they do need to establish so that you at least have their medical records. I mean, I know it seems so similar and parallel to ourselves, you know. And
it is exactly that. It's so parallel with human medicine side of things. We don't necessarily always correlate. It's the same with animals as it is with people, but we're limited, you know, just like human doctors. We have certain relationships we have to build before we can prescribe or we can treat or do anything like that. So knowing that you're coming, knowing that you have records from your other vet and having that available in case something happens, any type of emergency, or even, oh, my dog's shaking its head, I have an ear infection now. So, you know, simple things like that can happen when you're out of town, and that's something that we can definitely facilitate at certain times. So
that's great.
We try
That's
to.
great. So you guys do, we've talked about all the technical stuff, the x-rays, the surgery, ultrasound, all of that. You also do baths and beds. So you do some boarding and grooming that you have here.
Yes, we usually always have availability on boarding. Around holidays, it does book up quick. Especially with people traveling, they'll want to let them stay for the day while they're out on the lake. But with grooming, usually they can get you in within the next week or two.
Okay, great. So besides what do you need to know when let's say I come in and I bought a house on the lake, what are the things you need to know when I'm bringing in my cat or my dog or trying to establish this relationship? What are the things that I need to be cognizant of?
So a lot of times if you've moved from out of state or out of town, you know, having vaccine records up to date is very, very important. In this area, we have a lot of disease that we can prevent with vaccination, and sometimes if there's a lapse in vaccines or you don't have records, we would recommend boostering certain vaccines, especially if we don't know if they've had it before. For instance, leptospirosis, and especially around water, body of water, or anything like that, we're at higher risk for contracting that, which can cause a lot of damage. For those of us,
I just know we get that shot because of the stump water. That's what I call it. So tell us just a little bit about what that is.
So leptospirosis is a bacteria. It's shed in the urine of wild animals, by rodents, by deer, by anything that can cross your back porch, your back walkway. It is more prevalent in damper environments, but it's still out there. And if your pet's not vaccinated for it, they are at higher risk for contracting it, and it can cause acute liver and kidney failure, and they can get really sick really fast. And it is also something that can spread to humans as well. So, you know, we try to vaccinate the masses, you know, to keep our pets safe and keep us safe, because there's so many wild animal reservoirs that can transmit it. It's hard to not recommend those vaccines around here, especially.
So I think everybody got that vaccine except Bonnie, who didn't. She used a pee pad and everyone outside, so there was no reason.
And we do take that into consideration a little bit too. Is their environment and what they're exposed to? What's their behavior? Are they really indoor only, or do they go outside just to do their business? They're still at risk.
And they're still going to cross that path.
Exactly. Yeah.
So that's good to know, and so educational. So, Kristin, one other thing for you. I know Kristy's own. You worked here before and after Kristy. You still love the hometown feel, the small.
Well, I'm a lot like her. This is the only job I've ever had, so I'm just trying to follow in her footsteps and make her proud.
Oh, that is so important. So, what would you say about the folks that you've met here and the folks that you see coming across this table?
Well, I will say that I've had a rather positive interaction with the client base here. I strive my hardest to be as informative to my clientele as possible. You know, not everybody knows why we vaccinate for certain things, or why we have to look under the microscope at an ear infection or things like that. So I try to be very clear with my clients, and that has a very positive response from my clients most of the time. You know, so that's my job. The best thing I can do is educate and tell them why, and provide the best services I can to the patient themselves. And the staff here is very passionate about taking care of the pets and learning and growing and getting better at certain things. So it's a very good environment here.
That's great. Working. That is great. Is there anything that I need to know about LaFollette Vet Service that we haven't already talked about? We've talked about the crematorium being so convenient, the surgeries, the ultrasound. Do you guys have space for emergency surgeries, or do you book pretty much your surgery room?
So we're not necessarily staffed to the highest capacity to facilitate all emergencies all day long.
Yeah.
But on the rare occasion, for instance, last week we had an emergency that I had to do surgery on right away, from the hernia on its umbilical herniation. It got lacerated at the groomer, not here, somewhere else, and we had to put it all back in.
Oh gosh.
So some, depending on the occasion, depending on the presentation, if the client's able to give us a call ahead of time, if we can facilitate that, we will do our best to. Otherwise, there are some emergency clinics in the area that we can direct them to that would maybe be better suited for the case, the situation, depending on how severe it is, things like that. But we definitely do our very best to facilitate and fit in anything that has to come in
at that time.
And a lot of times we'll call the clients and just let them know, hey, we've had an emergency. Is it okay if we can reschedule you?
I'd say most would be,
they're more than willing to.
Happy to do that, because you just think, what if that were my dog or cat or whatever. So I think that's great. Well, thank you all so much.
You're very welcome. Thank you.